If AI agents were so powerful, then why do most enterprises stall before they hit production? In today's video, a startup called Instalily just raised 25 million to attack the exact problem with vertical domain trained agents. And they're claiming that big cuts in manual work in some of the hardest industries to automate. So it's very hard to automate certain things like operations, compliance, for example, especially when it is to do with care, healthcare, for example. So is this the new play that finally closes the execution gap? Well, let me go into this further. So this is really the news, is that they've managed to close a deal for 28 million. And they want to be able to scale their catalogue with pre-trained Insta workers, they call it, which is their trademark. So AI teammates that operate inside and execute real work across sales, service and ops in distribution heavy regulated activities like healthcare, for example. So most tools that they use are positioned for execution, and they are domain trained depending on what it is that they're going to be doing, for example. So think about when you hire a team member, and then you've got also with AI, what's happening is that it's vertical versus another co-pilot, for example. So here's why this is so newsworthy, is that a lot of agents are hype. They don't survive production. Multi-stepped agents still fail in a lot of ways in the wild currently. Recent benchmarking has put task success to around 30 to 35% for complex multi-step tasks, which is leaving a gap of 65 to 70%. So this is why we are really going into this in such a really strong way. And I've created my own vertical AI agents for this very reason, because I notice that it is hard to create something in healthcare that's going to be compliant, that is also going to function, that is also going to work, that triggers off other teammates. And yes, we also ensure that this is supervised by humans, because I don't think that we'll be able to just rely on this 100%. So it will do about 60% to 70% of the work, leaving your team members, your managers, etc., to be able to use this data to ensure that it is being used in the correct manner. We've also got to think about GDPR. So there's certain things like when you're creating a care plan, for example. Now this care plan needs to be created, and a lot of staff members, team members, are managers, for example, are using ChatGPT, but they're putting in the person's, they could be putting in the person's personal details. And this is a no-no in CQC and regulated, whether you're in the UK or in the USA. If you put in a blank template and say what it is that you want to be created from that, then that is fine. If you are creating documents where you put in the person's information, then that is not okay to do so, because you are breaking the safe and the confidentiality of the service user, patient that you are referring to. So that's why ChatGPT Oz was created, so it can be used offline. So it is kept in your platform. So it is kept on your system, on your server, not out into the world. So with this in mind, I created this legacy model, which I call the vertical AI agents, the healthcare AI agents that I've created. So I want us to be able to stay in lane, but also we can play the game of AI with the 35 admin first AI agents for care businesses, compliance chasers, AI CV screener, Rota builder, evidence pack automator, for example, to execute the most boring, error-prone work so that humans can do what we love to do, which is care. So if you run a healthcare business, home care business, or a care agency, staffing agency, and your AI, you're using ChatGPT, for example, AI, we can provide you with trials so that you can get to see what is actually in our system. Because we're looking at covering the whole operations, 360 degree of your healthcare business operations. So I'd love for you to book a free 15-30 minute call so I can do a demo with you. And also, I want to also mention that I am not affiliated with Instalily. This is basically for news and educational purposes as well. And that's the reason why I mention this, because things are stepping up for healthcare. And we are able to really be able to move forward with our healthcare businesses without being bogged down with all of the heavy regulation paperwork that we're facing and your managers are facing, for example. So my take on healthcare operations, well, we need deep systems integrations, genetic chats. So we've deployed 34 admin healthcare first AI agents that execute the boring work so that you can care. As I've said, we're going to be creating more as well. So go skills first, define your clear states and integrate. That's what we do. We integrate it with your actual systems that you have in place. So click the link here because I want to discuss with you further about how the 34 AI agents that I've built for healthcare businesses, because care is human after all. We cannot replace that with AI. It has to be done by humans. But admin isn't. So this can be done by AI. And my agents execute the boring, error-prone work, compliance, chasing, for example, but the compliance and the GDPR can be done offline. So it's kept in your system, kept in your business, for example. So why did I create AI agents for healthcare? Healthcare business owners. I know, I can see, I've been there myself. You feel like you're drowning in paperwork. You've got DBSs, NVQ, qualifications, certifications expiring, DBSs, for example, audits. endless emails, it burns a lot of people out and puts registration and contracts at risk. So after decades of me being in healthcare, I've learned the hard way that businesses don't fail for lack of heart. They fail from efficiency and overwhelm. The admin is predictable and its rules are based. So humans really should care, but we're focusing a lot on chasing documentation. So I created the solution. I designed the solution to create grade AI agents, not chatbots, that log into your real tools and also finish real tasks without operational humans in the loop. Compliance. We do compliance. I'm just mentioning a few things. CV screeners, rota builders, evidence-packed automators, but bearing in mind, when it comes to confidential information, we adhere to CQC and other regulated organizations, whether you're in the UK or whether you're in the USA. We adhere to that so that people's information is safe. It's in your systems, on your computers, on your servers, not out into the World Wide Web. So what are the results that we aim for? Time spent on compliance admin go down. Time to fill vacancy backlogs goes down. Onboarding cycle, time and error rates go down. Inspection readiness, evidence packs always current, goes up. Cash flow health goes up. Fewer delays, less missing paperwork. So we've already supplying care agencies in the UK. One of them is in Dagenham. We've installed 15 AI agents for their healthcare staffing business, showing how modular agents can scale without ballooning headcount. So my mission is to help care business owners to de-stress their operations so that healthcare professionals can deliver great care, so that you don't lose your business and provide a good business and avoid admin chaos. So click the link here. Let's map together your pipeline and I'll give you 3 execution wins that you can deploy this month. So join me, book a free demo here, and I will discuss further with you. Have a wonderful day. Thank you.